the next question. The question goes, my newborn is struggling to breathe, and the doctor mentioned something called RDS. What does this mean and how can it be treated?
So RDS typically in the newborn period stands for Respiratory Distress Syndrome, which is basically a sign of deficiency of what we were alluding to earlier, the surfactant. This is like a naturally produced substance by the lungs, and it is deficient in babies who are born prematurely, especially like under 37 weeks. More severe like when they are even more premature. So there is always grades and stages of this problem. Usually, like the very small ones, like for example, under 28, 27 weekers, they will need that medication given through a tube placed into the trachea. And like we are talking about invasive and non-invasive method, there is like several less invasive techniques that we are currently using to minimize injury. Okay, so there is medications for that. Babies tolerate this procedure very well. We monitor them for any kind of adverse or complications from the procedure. We follow them very closely. As you know, anything is a procedure that we have to be very cautious about.
And doctor, do you find that babies with RDS go on to have long-term problems because of it?
So typically, when they do receive the surfactant or on the ventilator, again it depends on the level of prematurity and how many doses they have required, how long they have been on the ventilator. So if it is something that they required the surfactant, but is breathing just like you and me, like within like the day or so, the chances that they have long-term problems is very, very low or zero. But if it is somebody that is a 23 weeker and required multiple doses and has been on the ventilator, is unable to wean from the ventilator, may need oxygen to go home with them, may need breathing treatments, at home, or medications that reduce the load on the lung, so to speak. Okay.
Mm-hmm.
And need
Doctor,
follow-up.
I'm so sorry.
No problem. Yeah, go ahead.
I was just gonna go ahead and ask how you would say that most babies can be protected from RDS. Is there any specific thing that you would counsel their parents to avoid these kind of things?
Sure, this is where prenatal care comes in. Okay, so when mothers receive a good prenatal care and they are recognized with some high risk conditions, or just baby, mother is in preterm labor, there are certain cutoffs where we recommend prenatal corticosteroids for mothers, so that the baby's lungs can be a little bit more mature than expected, or the function of that lung is a little bit more better. So there is a several, a lot of data that shows that prenatal corticosteroids, when mothers are in preterm labor, it has helped babies. So if you compare a mother that did not receive prenatal, if you compare a newborn whose mother did not receive that versus who has, there is a lot of difference there, and we anticipate problems when they don't, when they haven't.
Mm-hmm. Thank you so much, doctor.